Dear students, in this video you will learn about anxiety and its drugs. Okay, so first you have to know what is anxiety. So anxiety is a medical term which indicates that if someone is having stressful situation or fear or worry about everyday uh, work or his daily routine and he is feeling fear, then it will cause anxiety. Okay, means stressful situation, worried situation, or fearing situation. It may be intense and extraordinary than normal worrying. Okay, so anxiety is a part of life, but if it is intensifying that one, then it will cause anxiety disorder. So it is the mere indication of a certain disease. Okay, so it is the feeling, and it is because of the disturbances in the mind, and it will cause another disease. So it is the indication of certain other disease. Okay, so this is the initial stage of any other CNS diseases like depressants, psychological disorders, okay, psychosis, so mania. So those other types of disease may occur after long time of being anxiety people. Okay, so who are having long term anxiety, so they will produce other psychological disorders. Okay, so here about anxiety drugs means to manage the anxiety disorder. So first you have to know what is anxiety. Already I told you. So it is an emotional state. It is an emotional state. Okay, and unpleasant in nature and associated with uneasiness. Means whoever getting anxiety, so he will feel emotional and having unpleasant situation. Okay, not good situation for him or her, then associated with uneasiness, feeling uneasiness, discomfort and concern or fear about some defined. Means you know that okay, I have to do some hard work, so for that you may feel fear in future. Okay, so for defined purpose means you know the work and you are feeling anxiety. Okay, why this is going to happen, why not sometime others, why not I can do in other time, so like that feelings, so it will cause anxiety. So defined cause, because of defined cause, fear about some defined cause or undefined future threat. Okay, or something you don't know but you are feeling that it may happen again in future. Okay, so like I can give the example here. The best example is here for understanding of anxiety is that now COVID-19 is going on, so no one has thought that it will occur in future like this situation. So whoever not expected and certainly it happened for everyone's life, so someone will feel anxiety because when it will again go means go out. Okay, when we will be free again, so like that, so a stressful situation will cause. Then now future is in threat because everyone is not know that when it will be completely eradicated the disease. Okay, so this may also cause for some people anxiety. Okay, so number one, here I am dividing this one. Okay, the cause for understanding in clearly again. So some degree of anxiety is normal part of life. So this is very important. Means everyone is having little bit anxiety. It should be there in nature. Okay, so this is the part of life. Okay, means you can tolerate that one. So that is the part of life. So some degree of anxiety is a normal part of life. But if it is exceeding, so treatment needed. For disproportionate means if it is exceeding the situation or excessiveness, then it needs some medication. Okay. So anxiety drugs are nothing but ill-defined drug, means it is used for the that ill treatment. Okay, and mostly mild CNS depressants. So these are mostly mild CNS depressants. Okay, so the neurotransmitters which causing CNS stimulant effect, if these drugs are given, it will cause mild CNS depressant effect. Okay, so in antidepressant also I have taught you about what is depressant, CNS depressant. So you can watch that one later. Okay, so it will cause CNS depressant, but not CNS depressant disorder. Okay, so it will depress the brain CNS of reticular formation region, which is sending the signal throughout the brain. Okay, by forming reticular formation in limbic system in the brain. Okay, like amygdala, hippocampus, thalamus, hypothalamus in that region. So that region will be little bit controlled by the GABA receptor. Its work, because GABA receptor is the function to have control over the excitement of the brain. Okay, so that's why it is the inhibitory action on the CNS GABA. Okay, particularly GABA A. So what will happen if CNS is depressed? Control symptoms of anxiety. So if CNS is going to depressed, then it will control the symptoms of anxiety. Then produce restful state of mind without interfering with normal mental or physical functions. Not interfering, just controlling the stress anxiety situation. Okay, and it is not at all producing any disadvantage or discomfort to mental or physical functions. Okay, so these are the classifications about anti-anxiety drugs. Number 1 is the benzodiazepines, number 2 is azapirons, and number 3 sedative antihistaminic, and number 4 is beta blockers. Okay, so benzodiazepines we will see for this only. Okay, because this is most widely used drug for anti-anxiety. Okay, as a anxiety drug. Okay, against the anxiety. Okay, so first most probably used drug is diazepam. Mostly we are using the drug is diazepam, and more than this one chlordiazepam, chlordiazepoxide, because this is having long mechanism of action. Okay, then other is oxazepam, lorazepam, alprazolam. These are short action on the CNS, but this is little bit more than all other. And then second is the diazepam. Okay, then azapirons are buspirone and gepirone and ispapirone. Okay, then sedative antihistamines are hydroxyzine and beta blocker are propranolol. This is indirectly this is the beta blocker of heart. Okay, it is acting on the cardiac muscle. Okay, propranolol. So it is reducing the heartbeat. Okay, and to avoid the hypertension. Okay, so by that way anxiety will reduced. Okay, if heart is hyperactive, then it will cause again more supplying of the blood towards the CNS, and it will cause anxiety. Okay, if supplying of blood is more towards the brain, then it will firing the neurons more, neurotransmitters more, like dopamine, noradrenaline, acetylcholine. These are excitatory neurotransmitters, so it will cause again more anxiety. So that's why beta blockers is used. Okay, next, pharmacology of benzodiazepam. So before this one I am telling, so this is the presynaptic nerve, and this is the postsynaptic nerve. So benzodiazepine is binding with the neurotransmitter, so it is enhancing, it is reducing its transmission from presynaptic to postsynaptic by binding on the GABA A receptor, and it is inducing the GABA neurotransmitter release. By that way, it is directly or indirectly stopping the release of other neurotransmitters like dopamine and noradrenaline and acetylcholine, because these are the excitatory neurotransmitters. Okay, so if GABA's work is enhanced by the GABA neurotransmitter, then these actions will be reduced, so that anxiety will be reduced. Okay, so benzodiazepines enhance effect of neurotransmitter gamma aminobutyric acid, already I taught here, and at the GABA A receptor. Okay, resulting in sedative hypnotic. So what will cause this one? Then sedative hypnotic means sleep inducing. So it is inducing sleep. Okay, and reducing anxiolytic activity means anti-anxiety means reducing anxiety. Then the anxiety means fear or stressful situation or emotional unpleasant nature. Okay, then anti-anxiety, then anticonvulsant and muscle relaxant properties. So benzodiazepines can do these works all together. Okay, but our target is anti-anxiety. So it is used as antidepressant also, benzodiazepine. That's why here so many. What are the works of this benzodiazepine I mentioned here? Okay. Next, here two drugs only I have given here for pharmacology, pharmacological action. So first is the diazepam. Okay. So it is absorbed quickly by oral, okay, or IV, and T half is of this is having two plasma concentration binding. Okay, that's why 1 T half is 1 hour, and it is taking elimination phase. T half is 20 to 30 hours, means more time. Okay, and prolonged milder effect due to plasma concentration, because it is having two phasic plasma concentration. That's why it is having prolonged milder effect. Okay, and it is preferred in acute panic, means who are having less panic situation, fear, okay, or worry and anxiety. For those patients, it is using diazepam as a drug. So daily dose is 5 mg to 30 mg, and the marketed drug is Valium. Okay, and Placidox. This is also marketed drug. And for this Placidox, 2 mg or 5 mg or 10 mg tablets are available. So this is the for anti-anxiety drug. Okay, anxiety treatment. Then most used drug is the chlordiazepoxide. So this was firstly used benzodiazepines derivative as clinically. Okay, oral absorption is very slow. Okay, producing smooth, long-lasting, because slow absorption, then slow after absorbing, a smooth and long-lasting effect it will give. Okay, then preferred in chronic anxiety states. So it is most widely used because it is preferred for chronic anxiety, who is having more anxiety disorder. Okay. Then often combined with other psychosomatic, means other psychological disorders. Okay, like depression. Okay, or other psychological disorders. For that it is used with those drugs. Okay, with combination. For anxiety, particularly one drug, single drug is enough. So for HTHAB is 5 to 15 hours, but active metabolites produced extend duration of action. So here also why duration action is more, because they are converted to active metabolites. So it is having more duration of action. So active metabolites, okay, which extend the duration of action. Then it has poor anticonvulsant action, but it is not having that much good convulsant action. Okay, so daily dose is 20 to 100 mg, and Librium, okay, is the marketed drug. 10 mg, 25 mg tablets are available for the treatment of anxiety. Which anxiety? Chronic anxiety, means long, who are suffering from long period of time with anxiety. Anxiety, in common word, worrying about future situation or fear, okay, and stressful situation, every time feeling that thing, that is called as anxiety. Okay, so for those that anxiety treatment, these are two important drugs. So why duration of action is prolonged? Because of active metabolites are present, converted to active metabolites, these diazepam and benzodiazepines derivatives. Okay, and PK, pharmacokinetic, oral as well as through IV it is given mostly. Okay, but IM is little bit, because it is not that much accurately produce the effect, so it is erratic. Okay, so rarely it is used by IM, intramuscular, but IV and oral is mostly used. Then plasma protein binding is variable, okay, because of the strength of the absorption. Okay, T half, their plasma concentration binding power, according to that one, it is having plasma protein binding is variable. Okay, and metabolized in liver, this type of drugs, and excreted in urine. So this is about pharmacokinetic. So what are the adverse effects? So benzodiazepines have wide range of safety. So first, it is not adverse effect, but this is also I gave here because you should know that what is the safety range. Okay, so if less than safety, then it should be more adverse. So benzodiazepines have wide range of safety, well tolerated. It can be well tolerated. Okay, but common side effects are drowsiness, confusion, blurred vision, and amnesia, means short-term memory loss or long-term memory loss, amnesia. Okay, then some patients may, so for whom these common side effects will occur, who are using this drug and depending more on these drugs for long time. Okay, for long period of time. So dependency on the drug is not at all good. Okay, so up to the symptoms, if it is present, so that time up to patient should be used that medicine. Patient should use up to the symptoms to be elevated, means diminished or to be eradicated. Up to that time only he or she should use. Okay, not after the symptom. Okay, then some patients may produce paradoxical effects. Paradoxical effects means suppose this is the means opposite action of a medical drug, particularly. Okay, medicine. So suppose you are taking some painkiller or this diazepam for anxiety. Okay, but it is again producing anxiety, means that is giving you paradoxical effect, means opposite action, means which we want, that effect you are not getting, so that is called as paradoxical effect. Okay, so for example, convulsions or anxiety, means you are taking an anti-anxiety drug, but it is again producing anxiety more than that what you expected. Okay, so but anxiety is a part of life. For like suppose you are in a stage and giving some speech, so you may feel some anxiety. Okay, or in any certain event you are going to perform, so that time also you may feel anxiety, so that is not called as disorder. Okay, so this is mostly affecting the brain limbic system. So limbic system is a system which is having thalamus, hypothalamus, and hippocampus, amygdala, these four portions connecting and forming the limbic system. So if this system is having more excitatory neurotransmitter, it will cause anxiety and it will cause fast heart rate and drowsiness, and it will you will feel sweating, more sweating. Okay, palpitation, irregular heartbeat. Okay, so these are the effects which will cause due to anxiety. So if you are feeling these things, then you have to visit to doctor. Okay, so for this management, okay, this anti-anxiety drugs are used, mostly benzodiazepines. So up to this one about anti-anxiety drugs and its pharmacology. Thank you so much for watching. If you like this video, please share and subscribe.